name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk again.
And action. Hey everyone, Karen had a question about overreacting. Obviously this is regarding the current pandemic and whether we are overreacting or not. But so overreacting, which elicits panic, versus underreacting, which elicits panic and death. If this is the first time you're finding me though, don't forget to hit the subscribe button. Maybe share this with friends who are questioning, and also wash your hands and social distancing. So this is what we do in the hospital, not with regards to COVID, but whenever I wanted to use this as an example. Oh, by the way, this mask isn't going to, if I start coughing, it'll stop me from spreading the cough, but I'm using this, if you see me in public, to remind me not to touch my face. I'm using this is an old mask. So I have a bad habit of touching my face, and if I touch things and then go like this, which I just did, but my hands are washed, I inadvertently will probably infect myself with a whole bunch of things, not just COVID, but so that's why I'm using this. So don't be alarmed if you see me using this in the office and you're coming in for a physical. By the way, if you're 65 or above, or 55 with a whole bunch of medical problems and above, as far as the next 2 weeks, please, I would highly suggest we postpone all visits until we can see what happens with this surge in 2 to 4 weeks. So I'm moving everybody to April or so. So you'll probably get a phone call if you're going to see me. If you don't come to see me, or if you're just watching this from a distance, please be careful. And maybe you'll understand after I'm finished with this. So, do we panic or do we not panic? Again, that's the basis of trying to get people mobilized. The unfortunate problem is sometimes when you try to mobilize a lot of people fast, they don't move fast, and sometimes you have to tell them in the form of a little bit of a threat, I guess, and then suddenly people move too fast. But it's better to move and prepare and hunker down than it is to sit back complacent. And I have to say, I'm still not getting any test kits. I know there was a report over the weekend, and it was really good to see Trump and Vice President and Walgreens, CVS, CMS, really cool. But the follow-up report yesterday, Sunday at 4 p.m., did nothing to tell me the update. I'm still waiting. I think with Advocate Sherman at Good Shepherd, they're starting to develop drive-throughs. So that's cool. I praise Advocate for doing that and taking a step forward. But that's it. So I still have to assume that anybody with a cough, fever, chills, I don't care if it's all allergy, you have to assume stay home. So why do we do all this stuff and move quickly and cause a panic? Well, let me explain. When we have 000, going through training, medical training, it's always a stress response to any resident or medical school student when you hear code blue. Because you got to run. Everybody's got to swarm. But usually what happens is when somebody in the hospital, a nurse usually is the first one on scene, she'll find somebody unresponsive. That's 000. No blood pressure, no heart rate, no breathing. And immediately there's actually, you can pull the plug in the patient's room to call a code blue. Or you get on the phone in the smaller hospitals and you call code blue. The operator calls code blue throughout the whole hospital system. So anybody that's available will go. Usually to keep the discoordinated care and focus more on taking care of this one patient. It's a code team that gets to the place. So there's usually 2 nurses, a bunch of people with beepers. The 2 doctors on call, 2 nurses, a respiratory person, and another person. But in smaller institutions, you just call everybody because sometimes with complicated patients, especially when there's a lot of residents around, especially when it comes to intubating somebody, I'm going like this because usually when somebody's lying flat and they're facing up, and they can't breathe, you have to get a tube in to help them breathe or artificially breathe for them while you're going through the code and resuscitating them. And in some cases, some people have a difficult neck to do, so they have to call everybody. The anesthesia guy from the emergency room, the anesthesia department from surgery, the on-call team. So it's better to have all hands on deck, but not to the point where everybody's crowding. So everybody goes to the code team, and anybody that's available will go to the code. And then we'll do as much as possible. We'll swarm the patient and brainstorm, because there's algorithms that we go through in scenarios. And we practice that over and over and over again, because, and this is the reason, when you know your algorithm, when the team is working cohesively, you have great saves. The faster you can get a heart rate going, the faster you can breathe for the patient, the higher the chance that you will have a save. Now, in some cases where you have a lot of medical disease or age working against the team or the patient, it might be tougher to bring back a patient, but that's why you have multiple brains all in the room discussing, following the algorithms that we practice in residency and medical school that have been established. For the last several decades, you practice the algorithms, you put the algorithms in play, depending on, say, the EKG person. There's going to be a person that's reading the monitor, and the monitor person will read and say, this is the rhythm. And the code team leader will say, let's react this way, because we've practiced over and over again. When I take groups out on hiking, you might not realize it, but I'm a wilderness first responder, so I know about, in certain scenarios, what to do. Animal attack, ankle sprain, loss of consciousness, altitude sickness. I can enact something because I've practiced algorithms. So we practice that as physicians and nurses, because if you decide at the last minute when somebody's going down, okay, let me get the book out. What's the first algorithm? And then you have a debate. Somebody dies. So it's better to practice beforehand. So in the case where you have, again, practice, so that when it comes, when the threat occurs, it's easy, it's second nature, it's fast, and it's efficient. But in the case where you have this COVID, this is a novel virus. So the last pandemic, and I guess I consider myself privileged because I'm able to experience this now compared to 1918. There hasn't been a pandemic since then, at least with this speed of transmission and this lethality. Now, the SARS had a mortality rate that was much higher. I believe it was 10% of anybody that got it would die, but this is only 1%. Influenza is 0.1%. So you can see that influenza, it kills people, and it has killed people. This one is killing people, and it'll kill more people. SARS has killed a lot of people, but this one in particular, it transmits itself. This virus is brilliant. I hate to boost up a virus, but it transmits itself in unknowing people. So you could be talking, you could be pressing things, you could be holding stuff that you just picked up, and you could be infecting yourself with the virus from somebody else who had it at the station before you were there, and you can have some problems that won't present themselves till about 7 to 14 days later. So in the SARS thing from before, you would have massive symptoms, go to the hospital, and succumb. But because they were quick, massive symptoms, usually it was declared itself, this guy's sick. In influenza, slow, steady, and it doesn't kill as much, but this one, you don't have that many symptoms until later, and then when you find out, you've infected everybody else, and then they're going to bloom. So just because you're young, just because you're healthy doesn't exclude you. This virus doesn't care. So I think that when you prepare for that by saying lockdown, no restaurants. In Illinois, it's as of tonight, no more restaurants for at least 2 weeks. All restaurants have to close, and it's going to be an economic strain, but that'll be a problem that'll have to be addressed later. But I think if you swarm the country, swarm the state to do as best as you can to prevent any social transmission, then I think you fare better. Again, this virus doesn't care. But if you slow down what has happened in Italy, the system will be able to respond better. we haven't practiced for this thing, but we have practiced for mass casualty, and we have experienced influenza, but this is obviously ramped up compared to influenza. So what do we do if you haven't practiced scenario? You just call everything. You call everybody and you enact everything. And is that going to cause panic? Definitely. Is it overreacting? Definitely. But it's better to overreact than underreact. Italy, I can't say they underreacted, but man, they are so strained. You can say that the Italian people are older age group, but again, seeing the broadcast from the Italian doctors, they're intubating. The one Italian doctor said he just intubated a 20-year-old, and there's 50-year-olds that are on ventilator support. And when you're on ventilator support, you have to be on that for a while. And there's only so many ventilators in the United States. If this is supposed to hit hard, like it's expected, then all the ventilators will be taken up, and the ventilators they're accounted for already from regular crap that's happening in the United States, let alone this pandemic. So I believe last year, all-cause mortality had taken 2.5 million people, and this alone, not counting anything else, is supposed to take 1 million. So that's a rough estimate. However, I think that we're going to encounter a lot of crap. So it's better to overreact and then see. We can always go to school later. We can always get our paychecks later. You can always pay your bills later at a price. But to go to the hospital and take care of a sick one, when you can't even take care of a sick one because you're not allowed in the hospital, that's going to be a problem, to have death. So Karen's taking care of Uncle Tony, who was born in 1937. He's high risk. I don't want him going out, and I got to watch and keep eyes on. My friend Lori and her dad are coming back. Boy, I think it's safe to be on the plane, but hunker down. So I think when you have that rule that stay in place, don't move, wait and see what happens, I think it's reasonable. It's kind of spooky, but it's reasonable. But again, when we have a potential problem, a potential 000, if you've overreacted, you might be able to weather the storm. If you've underreactive, you're just going to be reacting instead of anticipating. We're anticipating a whole big spike, a big surge. So if we try to flatten the curve out, it'll take longer to take care of the disease, but at least you won't peak and overwhelm the system. So, and my friends who live in Canada, in the Caribbean, in Mexico, it's blooming here, it's coming there. There is no place that this virus hasn't been. So just because you don't have an active case, there was a report in the Caymans that one person died already, and we're cool. We're not cool. The fact that one person died means he probably infected 2 people to 4 people. And they're going to probably show themselves, hopefully they're healthy. Unfortunately, there are healthcare workers that are dying, and EMT guys that are being infected. But if you're healthy, you'll weather the storm. But during the time that you're weathering the storm, you just pass it on to 8 other people. And those people will pass it on to 16 other people. If you watch the Hopkins website, this thing is logarithmically increasing. I don't mean to be panicky, but it's nice to have data so we can react and maybe get ahead of it. But if you just wait till the last minute and say, okay, wait, react, and then you don't have supplies, you don't have ventilators, you don't have office space. So I can't stress enough that there's no such thing as overreacting. If you have a history of panic disorder or PTSD, okay, get into treatment, get your medical cannabis. But if you can deal with this, yes, increase the speed that you're getting your supplies or whatever you have to do. Toilet paper, it seems to be a joke now, but we'll wait. We'll do fine. His neighbors will do fine. His relatives will do fine. Watching over our elders will be fine. But I think that we should listen to common sense that says hunker down, stay in place, and try to avoid large groups. If you can do that while we see this thing bloom, cool. Right now in Illinois, once the test kits become available, you're going to see a big bloom because people will, even with mild symptoms, will be reported as positive. That doesn't mean you're going to have a surge into the hospital. It just means you're going to have positive cases. So be prepared. If the government comes up with producing all those test kits, you're going to see big blooms all over the United States. But again, mild symptoms, sniffles, fever, healthy people should do fine. Even my elderly patients, with their healthy, sniffles, fever, should do fine. But out of that, you'll have a small percentage of folks that won't do fine. So if we can decrease the transmission to those, the high risk group, that'd be great. I mean, how would you like to be responsible for the death of somebody, a grandpa? So we have to wash hands, social distancing, try not to touch too many things if you can, and try not to panic, but be smart. So hopefully I'll keep on broadcasting as I find that news evolves. But Karen, hopefully this gives you a little help. If you have anybody else that's kind of panicky or doesn't understand what's going on or is underreacting, please share this with them. Otherwise, we'll hopefully make it through this.